Hi friends, welcome to Physiodemic, and today I will tell you about the evidence-based practice for the cervical spondylosis cases. So I have gone through few journals to collect the data about the evidence-based practice of the cervical spondylosis, and these journals are the Journal of Manual and Manipulative Therapy and the Journal of Clinical Orthopedics and Trauma 2014, Asian Spine Journal 2016, Britain's Medical Journals and 2007, the Bone and Joints Journals 2013, and the European Spine Journal 2011. So I have gone through all these journals to collect some data about the evidence-based practice of the cervical spondylosis. So let's begin. Today I will tell you about the cervical spondylosis and its evidence-based practices. So daily we do get lots of cases in our clinical setups and hospitals of cervical spondylosis case. So let's start its evidence-based practices. Okay, so the study shows that in acute cases, a very few number of studies shows limited evidence of benefits of mobilizations and manipulations in cervical spondylosis case. And one more study shows that there is no evidence exists for efficacies of analgesics and non-steroidal anti-inflammatory drugs. One more study shows that in acute cases there is very less evidence exists for benefits of home exercises programs and exercises. So in chronic cases of cervical spondylosis, one study shows that is a systemic review of RCTs provide moderate evidences, various exercises like proprioceptive strengthening exercises, coordinations and endurance exercises are more effective than non-steroidal anti-inflammatory drugs and analgesics. And one more study like RCTs shows that exercise and infrared in combine is no more effective than TENS and heat therapy to reduce the pain. So when both these infrared and exercise therapy were better than heat alone. So some study provides limited evidence that the mobilizations and manipulations are more effective than pharmacological therapy, educations and counseling. So a study shows that comparative study that's combined exercise and manipulative therapies are more effective than individual techniques. And one systemic reviews of RCTs provide no evidence about the effectiveness of acupuncture and traction. Now I will tell you about the cervical spondylosis with neurological abnormality. The evidence-based practice for these cases. The comparative study shows that the epidural injections is more effective than the placebo treatments. Then one more study, that is RCT, shows that surgical intervention is effective to reduce pain for first few months, and on long-term basis there is no difference found as compared to the other three groups. That is the group those who are taking the steroid injections, and the other groups who are taking the immobilization therapy as the intervention, and the other group as the exercise as the intervention. So thanks for watching this video. Stay tuned to the Physiodemic channel for further new updates. Don't forget to subscribe and like the pages of Facebook pages of Physiodemic. Thank you.